This is Dr. Peter Emily. I'm going to be showing the application of SANOS, a companion animal veterinary dental sealant. Just finished a prophylaxis. I'd like to air dry the teeth before we apply the solution. After we air dry it, we can select one of the brushes. We're going to use one brush per quadrant, and we can reapply it. Notice how all we're going to do is just trace this into the gingival sulcus right under the collar of the gingiva, kind of like painting it subgingivally, and it dries immediately. And just apply it to all of the dentition. We're just going to trace it subgingivally. We can place it in the incisors as well. Again, would help to air dry the dentition. Try and get the solution into this contact area between the first and second molar, and possibly in the third molar. Post-prophylactically, many times you're going to get a little gingival bleeding. Simply wipe it and then keep your thumb pressure there till you get bleeding subsided, and you're going to trace it here subgingivally like this. And that controls the bleeding, just that little pressure on the gingival sulcus, and just apply it again this way. Sometimes it facilitates application to bend the brush at a 45-degree angle, and then simply holding it in this position, we can go into these contact areas much better. Again, if we get any suspected bleeding, we're just going to apply pressure to the gingiva, to the attached gingiva, and apply it as we keep pressure onto the attached gingiva. That will stop any of the bleeding response, and we can simply, using copious amounts of the solution, we're going to apply it to the lateral aspect of the dentition. Most generally, we get a little bit of bleeding post-prophylactically. And again, this is a perfect example of bleeding. We'll just put pressure there and introduce the gingiva, loosen into the gingival sulcus while we're applying pressure. The solution will go there, and then it'll dry instantly. If you care to, we can also place this subgingivally onto the palatal or lingual aspect of either the lower arch and the lingual aspect and the palatal surface of the upper dentition. Bending it at a 45-degree angle, as you can see, the brush just simply facilitates application, especially on the lingual aspect of the lower, as we see here, and on the palatal aspect of the upper.